Here and thank all of you for joining. So today, as Megan mentioned, yes, I've been doing this decades actually. So when I hear that out loud, it's like, gee, yeah, I really have. I kind of keep track of a lot of the time that I've spent with long-term care and with aging adults has been the length of my youngest child's age, who is now 27. So that's my marker for the time I've spent working with older adults. So I too am now an older adult, right? But I'll continue to share the knowledge that I have, and I hope that you'll be able to get some helpful information from what we're going to talk about today. So as you see, we're going to discuss long-term wellness, and it's about taking care of your health on all levels. Let's see here. I had my little clicker ready to go, but I'll use my screen instead. There we go. Let's see here. Here we go. So chronic disease is a really big deal. And you're probably going to hear more about that. It's really coming out that this is the chronic diseases that we have and manage. If not managed, can be very problematic, especially for brain health. We know physical health as well, but they really must be managed. And I'm bringing this up because I want you to please speak with your doctors to discuss any specific health needs that you have, medications that you're taking. If the medications have a side effect that you don't like, please talk to your healthcare provider and see if they can come up with a better plan for you. It's really important to keep these, what we call chronic diseases, under wraps. So here's the list of what we term as chronic diseases. Many Americans in the Western world suffer from these. Some of these can be managed with lifestyle changes. A lot of them can be managed with medications, and some can be managed with both. Okay, so for today's talk, I'll be talking primarily about the lifestyle changes. The medications I leave to your doctor to discuss, okay? So as you see, diabetes is considered a chronic disease, which affects the vessels in our body and the vessels throughout our body, as does high cholesterol, which causes blockage in our vessels. If we don't have enough oxygenated blood flowing through our vessels, including the vessels that go through our brain, then our brain isn't getting all the nourishment that it needs. So that's why we have to really pay attention to high cholesterol and also high blood pressure. That's like what it says, basically, causing too much pressure on the vessels. And we think specifically in the brain. And if that happens, or blocks of cholesterol chip off, that can create things like strokes and heart attacks and just diminishing cognitive ability because we don't have that fuel of that oxygenated blood. So please do make sure you're on top of that, with your healthcare provider. We also know another chronic disease, which may not seem like a disease, more of a condition, but is low vision, having loss of vision and loss of hearing. So we'll mention that during the talk, but please make sure that you're getting your routine screenings on that. Smoking, I think we all know that smoking, we've heard this discussed for a long time, not great for us. There are smoking cessation programs that are available, and even some medications. Again, your healthcare provider could help with that. And with obesity, obesity is a great limiting factor for many of our folks being able to get out and do exercise. They want to do it, but they can't because they're carrying around that extra weight, that may cause pressure on their knees and their back, and they just can't manage it. But as you've seen on TV, there are a lot of new obesity medications that you could talk to your doctor about and see if you're a candidate for. And also depression and social isolation. We may not think that's chronic, but if that's a chronic problem, that can really affect how we operate in our day-to-day life. And then, of course, physical inactivity. And we will be focusing the talk on some things that you can do that are soft on the joints, and hopefully you'll be able to find something that interests you. So I actually picked this picture of this beautiful tapestry. I love it. But also think that it symbolizes the components of human wellness, right, for all of us. And so the different colors and different shapes to me represent physical health, our brain health, environmental health, how our environment is. Do we live in a polluted area? Do we have like 15 flights of stairs that we have to get upstairs to our home? In our social and leisure health. And all of these are very important components of having healthy wellness. So first of all, I think we've talked about this a lot on CEP Live, but physical exercise is really important. And so we'll talk about kind of the parameters for that. Also, just having some sort of a consistent engagement with social activities. Any social activity, it doesn't matter. There are no rules. These guys are bowling. You can do anything you want. And by participating in physical exercise and the consistent engagement in social or leisure type activities, we know that this correlates with greater resilience to cognitive aging. That means your brain does better when you do these things and incorporate them into your life. And the flip side, unfortunately, is true too. The lack of engagement in exercise and social and leisure activities is linked to a decline in cognitive health. So we're also going to discuss just a few tips. I'm not going to burden you too much with ideas to keep your home and environment a little bit safer, but we will touch on that. So first, here are the guidelines for exercise. Now, as I realized, I put on this picture, it looks like a boot camp or something. I'm not suggesting that you jump into a boot camp by any stretch of the imagination. I just thought it was a nice photograph to show. So what is recommended is 150 minutes of moderate intensity exercise per week. And we all think, okay, how many is that? How many? Okay, so here it is. It's 30 minutes, 5 days a week. So that could be just 30-minute walks, 5 days a week, or 50-minute workouts, 3 days a week. That's kind of the minimum that we believe is good for our body and our brain. And it's important to try to keep a consistent routine, find something that you like and that you actually want to do. And maybe you'll see the same people there, so you'll get that extra benefit of socialization, which would be great. And then we also believe that improving, some strength and balance and aerobic activity should be done about 2 days a week for the resistive. And the guideline for like how much is too much, as long as you can breathe while you're exercising and talk, you're okay. If you push any harder than that, you want to back off. That's too much. So just being able to talk. So you're out on a brisk walk and you can talk to your friend, talk to your family, talk to your dog. That's okay. But once you start panting too much, you want to definitely bring that back a little bit. So as I mentioned, you have to find something that you like, right? So these paddles happen to be pickleball. So those of you that are pickleball players, I guess you would recognize what they are. But there are a lot of different activities that you can do. And so I just put a whole list of ideas that I could come up with. Yoga and Tai Chi are wonderful. As you know, your host, Megan, is a yoga instructor. Just taking a walk is beneficial. You could incorporate that into taking photographs in the woods, just taking any sort of a nature walk. You could just walk around your neighborhood. You could walk around the mall. See the people that are shopping, look at the windows as you're going by. Strength training and weightlifting, of course, is good. Dancing, you could take a dance class. You could just go swimming at the Y. Some of our clients are swimmers and they've done that their entire lives, which is great. Hiking is another possibility. Sports like tennis or pickleball, basketball, golf, bowling. I'm sure I forgot many, but whatever is interesting to you, whatever you like is what you should do. And then, of course, gardening, I included that as the final one. I like gardening, and so that has a lot of benefits. So that's a fun thing to do too. And you don't have to have a huge garden. You can have 2 little plants in your window or outside and just tend to them, and just being outside and watering them and adding a little fertilizer. That's gardening. It can be very simple. You don't need raised beds or anything like that. One of my favorite classes, maybe many of you have heard of this, it's called Silver Sneakers. And I've attended this a few times so I could get a firsthand view of actually what it's like. I've also tried different classes so I could get a feel for the instructors to see how they operate. It is a really great program, and I would strongly recommend it if you're looking for an exercise class. Maybe you haven't been an exerciser and you'd kind of like to do something, but you're not sure what. So Silver Sneakers is usually held in places like LA Fitness or Planet Fitness. Some of the insurances do cover this class, so you'd have to check to see whether or not yours does. It's sometimes the Medicare, the not straight Medicare, but the other HMO type things. But anyways, they lead the classes designed for people 65 and older. There are always chairs just like this. This is a really good example of what the classes look like. So you can sit in the chair and do your exercises, or you can stand. Some people are comfortable standing, some aren't. So that's very flexible. And the weights can be used or not used. Again, that's optional. So it's a really nice program. And I like Silver Sneakers, not just because of the exercises that they provide, but also because it appears to be a social thing too. So the classes that I've attended, the people in the classes seem to know each other and start chatting it up. And so they're regular attendees. And so then you kind of build that social network as well as getting exercise. So I would encourage checking Silver Sneakers out. And also our very own Cognitive Empowerment Program YouTube channel, as Megan mentioned earlier, has a host of great exercise programs for you to join. Now, this is not going to give you that socialization, right? But you can watch them at home at your convenience. Megan is the host of this program, does fantastic chair yoga classes. She is an expert. I don't remember the exact level of yoga, but it's so high, I can't even remember it. So anyways, she does a fantastic job, strength, balance, and flexibility, and also just learning that calmness and how to relax. I've had clients that have Megan's class before they come in to see me, and they're all like loose noodles. Oh, I feel so good. I feel so relaxed. Yoga's wonderful. And these are people that had never taken yoga before. So I would consider that. Megan also had like 15 or 20 minutes she did for the staff at one point, and we all sat down in a yoga studio, and many of us had not done it before, and it was wonderful. It really was. And I think for me, I realized that there were a lot of tight areas in my body that I didn't even realize I had. So I'd highly recommend that. And then there's Tina. Tina is the master of Tai Chi. She is also equally as wonderful and experienced, and will provide a gentle exercise program. Tai Chi has a lot of research on fall prevention and strengthening and balance. So you might check that out. Or also, if you just like regular exercises, lifting weights and jogging in place and that sort of thing, Mark and I and Tony are very creative, and they also have a great program that you could tune in on our YouTube channel. I always need to bring up falls. It's kind of a negative, but it's important that we know this. This is kind of an old chart because this is showing the rise up until 2016. But by 2030, there are actually going to be 7 deaths every hour that are caused by a fall. Now, this doesn't mean that, we're walking around and we fall and we die. That's not what happens with this. So what happens is that a person falls, and they injure something, maybe a traumatic brain injury, maybe a pelvic fracture, a hip fracture. And then the thing is they maybe don't recover, quite as well as what was anticipated by their therapy team. So they're not able to maneuver and mobilize like they were previous to the fall. So it's then this kind of this low, slow decline of function that happens. And then eventually these people pass. And so it is recorded medically as a fall death because the person's initial insult was a fall that caused such the issue that then resulted in this person passing. The good news, bottom phrase there, many falls are preventable, and we're going to talk about a few things. So I'm not going to get into it in full depth today on the home stuff, but of course we want an environment that is comfortable and safe. Of course, this is a really dramatic picture of a really messy house. I don't mind the stuff that's up on the shelves, but we really don't want things on the floor. It's very easy to trip and fall. It's hard to see the wires that are there and the slippery magazines and that kind of thing. So you want to clear the clutter so that you have a clear walking path in your home. Also, lighting is very important. Aging eyes tend to see bright white lighting better. So in the kitchen, the places that you spend most of your time, you want the bright white light bulbs so you can see what you're doing. And also at nighttime, you may want to think about toning that down a little and using light bulbs or night lights that have a little more of that amber tone. The amber tone is less disruptive to the sleep cycle. So that's why we think they should be in the bedroom. As far as your home goes, if you have any broken steps or railings that aren't working, please think about getting those things fixed. Or if you have a specific problem in a specific area of your home, you can ask your physician or your practitioner, could I please have an OT come to the home? Or could I have an OT consultation for home safety? And they will do that for you. It would be a home safety evaluation. So this cute rug, it's very cute, but rugs like this, even in our kitchen, are a trip hazard. And the reason for that is we all walk differently. And so as we swing our feet through, right, we call that the swing phase. Some of us lift our feet up a little higher, above off the floor, and some of us don't. So those of us who don't, especially, are more apt to catch the toe of our shoe on that rug and fall. So there's certain conditions where people tend to shuffle more or just the way that they naturally walk. So we kind of generally say then just not a good idea to have those because it could be a risk to someone in the family. A routine thing that I don't want you to forget about is having your eyes checked. Really important. Aging eyes need to be checked frequently, more so than when we were children. So please schedule your routine eye exam. There are certain types of dementia also that can change how the environment is interpreted visually. So just kind of keep that in mind. And again, as I mentioned, aging eyes prefer that bright white lighting, sharper contrasts, have a harder time adjusting to like fog and darkness when you're driving, a harder time with the eyes adjusting when you're outside in the bright sun and then come into the home in a darker space. So just take your time with that and realize that your eyes will need time to adjust themselves. Just like everything with age, it takes a little longer for our bodies to adjust. And just a quick mention there, I have the colors of red and orange and yellow listed there because those are the colors, the side of the color wheel that aging eyes see better. So sometimes the dark black kind of fades into the background. So we get sharp contrast and the red, orange, yellow versus the blue and greens, which can kind of fade and start to look a little more gray. It's very important also to get your hearing checked. It limits the engagement, right, of how people participate in class or life. We've seen it in class, Megan and I, but you'd want to see an audiologist. And it will really, there's so many great things about hearing aids now, compared to what they used to be like, where they used to hang on the front of the people's shirt and they'd squeak a lot. It's nothing like that anymore. It's very high tech. And it will really help your brain being able to pay attention better, help with memory and concentration concerns. There was a study that was done, and I have it linked at the end of the slideshow if you're interested, but it talks about the use of hearing aids. There's a lot of discussion about this in reducing the rate of cognitive changes, and they found that using hearing aids for people who were at risk for dementia found a 50% decrease over a 3-year period. So by using hearing aids. So those who are at a high risk of developing dementia got the hearing aids and did much better. So I would recommend that you do that. And this is another thing, a lot of us maybe don't talk about this too much, but I do. It's really important to realize that urgency, bowel and bladder urgency, is something that happens to a lot of older adults. And so they rush to the bathroom. And believe it or not, this term, rushing to the bathroom, is actually an actual fall prevention or fall risk, is actually a fall risk. CDC has it posted all over everything. So rushing to the bathroom is really a thing. So I'm recommending that you just use additional protection if you need it. That's why we see these advertisements all the time. A lot of people use them. They're more like underpants now with padding in them. They work very well. People are independent with them. So try that out. Also, if you are also concerned about that, a pelvic floor exercise program may be beneficial. You could ask your physician for an order, your nurse practitioner, your PA. Occupational therapists and physical therapists do this and teach people how to strengthen the muscles of their pelvic floor. And this in turn helps with the incontinence of bowel and bladder. Okay, we got to think twice. Think twice about ladders, think twice about step stools. Can be pretty dangerous. So I would say if you have somebody else around the house that can get things for you if they're up high, I'd recommend that. You really only want to use this for people that have really good judgment and good physical ability. Ladders I'd stay away from completely. I've seen the other side of that, right? In the rehab side, and people who have injured themselves very badly by falling. So just trying to like change knobs on the cabinet or trying to change a light bulb, and things go bad quickly. So and the older body can't bounce back like it did when it was 20 years old. So see if you can get somebody to help you with that. And just something to keep in mind in general, if you keep items that you need regularly between your shoulders and say your knees, then you can access pretty much everything you have to. And there is the little reachers I want to show you again. A lot of clients would call them picker-uppers or all different names. But anyways, it's officially called a reacher. And there are different versions, foldable, longer ones, shorter ones. The ones on the right, the 2-pack, that happens to be a lightweight. So that's for picking up things like, if you dropped your pair of socks, you can reach over and pick them up. If you need to get a pack of Kleenex on an upper shelf, you could probably use that. A lot of them have magnets also in the tip, which is also helpful. The other one that has the suction cups, that reacher is designed to be able to lift up like a soup can out of your pantry, things like that. So a little bit heavier, not real heavy stuff, but they're useful to have around. As far as mobility, if any physician or healthcare provider has recommended that you use a device, so a device meaning a cane or a walker, please do so. These recommendations are not given out lightly. They know that there is an underlying balance and mobility issue, either through a standardized test that they did or through questionnaires that you figured out or that you completed, and they saw flag, and knowing that you were at risk. So please use them. There's some really nice looking canes, and probably you could decorate your walker to look really nice too. But they do help with mobility. And then that will help you from not falling, right? So a freestanding chair is pictured here because I want you to know what a really safe chair at home looks like. So we don't want any rolling chairs around, not safe. They'll get away from you in a half a second. So this type of chair, like a standard dining room chair, even if you don't have one, I've had clients that have just gone to Goodwill and said, I just found like a really nice chair over Goodwill and it works fine. So the idea with this is for sitting, you want to feel your legs on the back of the chair first as you approach the table. Feel the back of your legs and then reach back with both arms so you feel both handrails and then sit. Okay, I've had people that have missed, and so that's kind of why we want to review that. That's specifically how you want to do it. If you have concerns about your mobility, concerns about pain in your back, your knees, whatever the case may be, the state of Georgia, and I know some of you are not from the state of Georgia, but we could check and see if you're a direct access state. But a direct access state for physical therapy means that you could just call up the physical therapy office and schedule an appointment. You do not need to go through getting a doctor's order for that. And I believe in the state of Georgia, you'll have 8 visits that are covered, and then they will consult with your doctor and see if you are to continue. So that makes it really easy, to get some therapy if you need it. I have to tell you a little about shoes. Shoes are a fall risk. So no high heels, okay? But I did put a shoe with heels on the left here because I think it's, women want semi-nice shoes to be able to wear, right? Don't want to have to wear sneakers all the time. So the key for the one with the small heel, number one, it is a small heel. A non-slip sole is on this. And as you can see, the front of the foot is covered and the back of the foot is covered. It has really nice support. So that type of high heel is okay. The middle one is a Skechers. You guys are all familiar with Skechers, right? Skechers are great. They're just slip in and they meet all the criteria. No laces or straps. The heel height, is fine, supports the entire foot. The really good non-slip soles. So all types of Skechers or sneakers are fine. And then on the other hand, we have some, hard to tell right there, but they're little Nike slides over there, or slippers, things that don't have a back on them. Your toes are exposed, fluffy slippers. Yeah, we just want to stay away from those. Even the clogs, because sometimes they can become kind of loose on the foot. You want something that really holds the entire foot in place. And we really wouldn't want you to fall just because of the type of shoes you're wearing. Okay, next slide. Well, we've talked about this before, and I think we all know that stairs are risky, right? So that's why I mentioned earlier, make sure you have your railings indoor and outdoor that are secured if you need to do stairs. And make sure the lighting is bright enough for you to be able to see. The concern for falls is greatest on that last step as you're going down. And sometimes that's because the railings don't extend that far for you to hold. So make sure you're holding on to it at that final step. And it's the change of surface. So just be mindful, extra careful on that final step as you're going down. The second highest fall is actually when you're going up. So people trip on that top step as well. So try to give your full concentration, when you're climbing stairs, and don't have a bag of, laundry with you and carrying things up the stairs. Just focus on the concept of just walking safely up and down the stairs. And if you do need to carry things, what I recommend is like a backpack or a crossbody satchel. And if you have someone in the house who can carry a big laundry basket for you up and down the stairs, then have someone do that for you. There comes a point when none of us need to be doing that anymore. Okay, into your bathroom. Good idea to add grab bars, security bars, really all around your bathroom, the shower and the toilet areas especially. They have a nice selection in this picture. If you have any kind of pain in your back, in your knees, or if it's endurance issues where it's hard to stand and take a shower because you're out of breath, just having some sort of a shower chair or shower bench is just really helpful. I would say do yourself a treat, buy yourself a present, and just get some sort of a chair or bench. This isn't probably the best example that's shown in this picture. What I recommend is a chair that has adjustable legs, so it can adjust for a man who's 6 feet tall or someone who's 5'2". And I really do like the arm supports because it's the same concept as with the standard chair. You'll feel the shower chair on the back of your legs. You'll have the arm supports to be able to push up and down on. And they do all come with the little non-slip feet, so you should be pretty good on that. And again, back to the bathroom. The injuries where people get hurt are in and around the tub and shower. So we're going to spend another slide on this one. I like non-slip mats inside and outside of your shower or tub. And I'm kind of picky about the type. You can get whatever type you want, of course, but I find that the ones that have texture to them, so the one on the top is a loofah. So the foot is going to feel that sensory input on the bottom of the feet as you're standing in your shower. And if you think about it, the shower, most people who wear glasses don't have their glasses on in the shower. It's steamy. It's kind of hard to see. That can mess with our balance system. So if you have a bar to hold on to, and then the sensory input of this loofah type mat in your feet, it gives you a little extra edge. And as you're stepping out, this is a memory foam, the one on the bottom. This is a heavier mat. You definitely don't want to step out onto a tile floor. Or a wood floor, a laminate floor. You want to have a really secure mat to step onto. I really don't care for the ones that do not have any sort of a non-slip on the bottom. So you want a non-slip base. This memory foam is heavy enough, and it also has a little bit of a non-slip base. And so as you're stepping out, the body then feels planted in the softness as the feet go down into that memory foam. So maybe if you have your birthday coming up, you could ask for a couple of these for your shower tub if you're interested. Okay, we're going to shift over to leisure activity. Looks like these people in the picture are just having a lot of fun. Maybe they took a walk together or something. But we know that the mental health of those with mild cognitive impairment has been shown to improve by doing physical and sedentary activities. So you don't have to be out on a walk to get the mental health benefit. Right? So that means you could be sitting around a table playing games with friends of yours. You could be playing cards, whatever it is, as long as you're doing an activity and you're doing it with other people. And what we know is the result of this is that we feel happier, we feel less anxious, and we feel less lonely. And I think those are all great things to shoot for. And volunteering is another type of leisure activity. And so there's so many things that you could do in your community. And volunteering has also shown to have protective effects on the brain. And so it looks like these people are maybe loading food at a food pantry. You could do that. There's animal shelters. There's always faith-related activities at churches or temples or mosques. Local government may have little jobs available of answering the phone, also reading to children. The list goes on and on. So, just think about it or talk to your family or friends and see if they're doing something they enjoy. And then it's kind of nice because you're out there with like-minded people and you're contributing to the greater good. And just that feeling of contributing to the greater good is also important to the aging process. Other things that you could try out if you are motivated to take an educational class. You could take a full-on class. You could take like an OLLI class, OLLI. That's the Osher program. We offer that through Emory, but they are a national program. So you could look OLLI and see if there are any in your area. You could just join and start taking exercise classes. You could learn a new sedentary activity. One of the girls in our office is learning canasta. And she says it's pretty hard. So you could learn anything you want, poker. You could learn how to do yoga by joining Megan. You could pull out a hobby that you used to do. Think, gee, what did I do when I was younger that I really enjoyed? For me, it was collecting 50-cent pieces, Kennedy heads. I enjoyed that. And I'd put them in books. I still have them actually, and see what year they were from, what mint they were from. So what everything you may enjoy, just think about that and try to brainstorm and find out something that if you enjoyed it when you were younger, you'll probably still enjoy it. And also joining a group or a club of people that have common interests. So we discussed this a little bit in one of the classes recently. And I was saying, okay, they were getting ready to graduate. And it's like, okay, what are you going to do, moving forward? And it turned out that we had one woman that said, well, I love to golf, but I don't golf because I don't have anybody to go with. Somebody on the other side of the room said, I love to golf. So it was a match made in heaven. So they realized they both love to golf. So they were making plans to go golfing and kind of resume that fun activity that they enjoyed, but they didn't want to do it by themselves. And of course, a little plug for gardening. Many of you know we have a beautiful garden here at CEP with raised beds. It is a beautiful place, and it benefits us physically, emotionally, and mentally. And long ago, there was a Dr. Rush, and this is before pharmaceuticals were a thing, and he had worked in a psychiatric unit. So he had a group of men who had mania problems, manic and depressive symptoms. And there was no medication, right? So he decided they would do activities in the facility, but he decided to send half of the men out into the garden and have them work and shovel and help build this garden. And then he, compared the two. And he said, wow, the guys that were outside digging and working in the dirt, their symptoms have dramatically decreased. So we do know that working in the garden is a non-pharmaceutical way to enhance well-being. So, and you don't have to be an expert at all. So just going out there and even just enjoying a garden is a great way to do it. You don't have to plant. You could just walk around the garden or walk around your neighborhood and just, take it in, because it is really beautiful. And, whatever it is, it may not be gardening, you may not be a gardener, that's fine. But anything that gives you joy. Exercise can be fun. It should be fun. And we hope that will benefit your brain, your body, your social life, and in the big picture, just keep you healthy. So that's my challenge to you. Just think about, what may be fun and just act on it. So silver sneakers is always a good way to start. Can't miss on that. So I want to thank you guys for listening today. And I do have a link sheet if you're interested. There is a Lancet report on dementia that you may be interested in reading. And there are also articles talking about the hearing and dementia risk that I thought you may find interesting. So please take a look at that if you would like.